All right. So there are two scenarios you have when you walk into the sedation room. You've got what we call when the tiger is happy. So that's either the tiger is resting peacefully or the tiger just is distracted and the tiger's not upset, okay? And when that happens, the doctor walks into the room. We really have our primary dental assistant and we have a secondary dental assistant that comes into the room, all right? The primary dental assistant, what is their role? To assist the doctor, to help the doctor get through this experience like as quietly and peacefully and happily as possible, right? And then what is the second dental assistant supposed to do?
To hold the child and check vitals.
Hold their hands, make them feel happy, make a happy feeling, keep the tiger in a happy place, right? And read their little numbers and help write the numbers and all that good stuff that happens in that room, okay? So that is how we deal with the sedation. That's hopefully how most of our sedations go when they have the tiger that we've kept happy. We're not moving things around. We're not turning the TV up, brother. We're not turning the lights on. We're not doing things that are going to wake up the tiger, okay? However, there are times when something happens that the tiger's not happy, all right? Or becomes unhappy because they get aroused in some way. Maybe they feel maybe they feel the injection. Maybe they, all of a sudden, the medicine stops working as well. Maybe brother says something to them. There's a whole bunch of things that can wake up the tiger we're trying to avoid, all right? So when that happens and we have the angry tiger and the tiger starts coming at us, all right, the first thing we have to do is we have to get someone else into the room to help. So our third dental assistant, let's talk about what those roles are. And this is what my creature is. This is the dental chair, and these are the roles going on in the sedation.
Okay. We were way off.
Okay, so here's the scenario. Because some of you in the last while either are new or had their first experiences of going in and trying to help with the angry tiger situation, okay? So this is looking down on top of the dental chair and in everybody's roles, okay? So first off, the doctor is going to be right here in this position because our patient's head is right here. There they are, okay? There's the tiger. So the doctor is here. So our primary assistant is going to be here, right? Mm-hmm. And what is their role? It hasn't changed, right? Except now, going from like the sweet, happy little, let's keep the tiger, nice and it's now gone to like, we are now working on a tiger, and so we're going to work as fast and furiously as we can, right? So these two people are focused completely on just getting treatment done as quickly as possible, all right? All right, dental assistant number 2. They were here helping the tiger, hands and legs or whatever it was before, but their role has also changed. They've gone from just petting the tiger to now trying to hold on to the tiger without letting go, right? And then our third assistant is where?
Head.
At the head. All right? The roles when the tiger comes out really change drastically for numbers 2 and number 3, okay? Because part of this is not only do we have the tiger in the chair, but we also have the mama tiger, which is usually hanging out like over here somewhere, right? Okay? So naturally, it makes sense that the roles need to switch places, okay? Who at that time is best to become the person, this assistant's helping the doctor, but who's best to talk to the child and help the child try and feel calm?
Head.
Number 3 right here, right? Mm-hmm. The head holder's right there by the kid's head. They can talk to them, they can try and reassure them and calm them down, okay? And who's best to talk to Mama Tiger? Number 2 is, right? All right? So one of the roles that seems to always happen is that when the tiger starts to go, kind of get upset, everybody wants to talk to the tiger. Does that make sense? The doctor, the person, all 5 people are talking to the tiger. Do you think that makes the tiger happy? No. They have 5 people trying to help, but it's really making things worse. That's why everybody's role is so important. And this becomes Mama Tiger's helper, this becomes Baby Tiger's helper, and Doctor Helper. Okay? Does that make sense? So those are the roles that then unfold in that moment when the head holder comes in. Okay? Everybody's pretty clear on that? Okay. A couple things I want to talk about and demonstrate then. All right? Let's see. Lorena, come on up.
She's like, I'm new.
I can have you 2 stand up. And actually, I can be my volunteers too. All right. Okay, Lorena. I just picked on you because you're not as tall as some of the other assistants. Okay. All right. Well, I think we have a pillow here, right? Okay. Oh, it's somewhat comfortable. All right. There you go. So you get to lay down and you get to be the tiger. How exciting! All right.
Okay. Perfect size.
So. Doctor's here, of course. Assistant 1 is here, of course. Let's just demonstrate position 2 and 3 then, okay? So I'm gonna have you scooch up just a little bit more, right up to almost to the top of the, there you go, very good. Okay, so head holder is gonna be on their knees directly behind the patient. That means the doctor also has to shift this way just a little bit, okay? And what they're gonna do is they're gonna come up and they're gonna put their hands up over on the sides of the patient, all right? One side is gonna be holding the nitrous and probably the hose or the mouth prop. And the other side is just gonna hold the nitrous, all right? And what the goal is here is not to squeeze the tiger's head, right? You're just trying to keep them in the same place. You're gonna hold the mouth prop, you're gonna hold the nitrous, and just gently hold the patient's head right here up at the top of their head, not down by their face, okay? And just try and keep them from turning left and right too much. Because that's really for the doctor the hardest thing, when the patient turns this way or turns that way. You try and keep them from making those really hard turns. A little bit of turning is fine, a little bit of movement is fine. You're not holding them down or anything like that. You just want to try and keep them in that same basic position. And especially help keep things in their mouth, okay? Because when things come out of their mouth, that's the second hardest thing the doctor has to do with, is getting everything back in again, all right? Once it's in the tiger's mouth, it's real easy, but once it's out, it's hard, okay? So that's your role right there, okay? Now, the number 2 position down here, okay? If you find yourself in this position, there are 2 key places you need to hold onto the patient, okay? The first place is where you hold their hands, all right? You're not actually gonna hold their hands, okay? You're gonna hold their wrists, okay? You're gonna take your hands and make circles, and you're gonna hold around their wrist, okay? The wrist is the bony part of your hand, and you're not gonna squeeze them or hurt them if you're holding around their wrists, okay? And you're gonna take it, and you're gonna hold it against their stomach, all right? And you're gonna let them be able to move a little bit, that's okay, but again, it's holding around their wrist and keeping a firm hold that way, okay? Having their hands come up and interfere with the doctor, again, makes the doctor's job hard and also makes them much more likely to hurt themselves, okay? Now, the tiger may also have their legs going too, okay? So how do you manage the legs, all right? The place you hold on is right at the mid of their thigh, okay? And what you're gonna do is you're gonna put your arm across their thigh like this, okay? Or if your arms aren't long enough, use your arm like this, okay? So you got a wrist here, you hold it like that, okay? Does that make sense? And if you hold against their knees, you have a potential of buckling their knees backwards, which is very painful, all right? And if you get too far up on their waist, guess what they do? They bend their knees, they put like this, and you know what they do? They shoot that way, right? Okay? So that is how you get yourself in a position for the patient over there, right over the middle of their leg, and it gives you the most control over them and hold everything in place. Make sense? You can sit up. All right? There we go. Everybody feel pretty good about that? No more to do. It takes some practice to do this. You ladies can sit down. All right. So there's our positioning, okay? All right. Any questions on that? Couple
I
last.
have to say, it now makes sense to me because I tried it a couple times and Alan tells me later how bad I am playing assistant number 2. And I get it now because it's not restrained. It's more maintained.
Controlled freedom.
And controlled.
Just a little bit of freedom, right? Okay. Couple of quick things about sedations that are really key and important, okay? First off, before we jump into head holder scenario, okay, there really needs to be something that happens. That's called the parent timeout, okay? When you get to this point, we're trying to get some work done as quick as we can, and we are not doing it against the parent's will, all right? We are doing it to try and help finish up what we've already started, or to finish a treatment plan or something that the parent agrees to. So a parent timeout should have taken place by this point, okay? That's how the parent gets on our side, so we can start talking to them and reassuring them during the tail end of this visit, okay? Also, anytime we have the parent, timeout that happens and the head holder comes in, there needs to be a customer service check, okay? It's a traumatic thing for a parent to have to go through, to see their kid go through this experience, and it's important that the manager come in after all the dust is settled. They come in and just talk to the parent, make sure they're okay, okay? That is how we get through hard treatment without upsetting parents. We talk to them beforehand, we give them the options, they make the decision, we get through it as a team, we talk to them, we reassure them as best as possible, and the customer service comes in. If you do that, parents will not have customer service issues, all right? It's a hard situation, that's how you get through a hard situation, all right? That time also means failures might happen, okay? So there's a system for sedation failures when they take place, all right? When that happens, we have to make sure the dental code gets put in for the failure. We have a write-off for customer service check, or the failed treatment that has to be taken care of as well. And again, making sure the customer service check happens, all right? Back to the beginning of sedations, all right? All patients that get diagnosed for sedation should get one of these cards, okay? This is really key and important, all right? It's important we don't forget this is part of your treatment presentation. You should be handing them this, they should be getting this card somewhere along the way. In fact, the ideal time is when the diagnosis happens, you let the doctor hand it to them, okay? Because the doctor's the one that's supposed to be talking about nitrous, sedation, or GA, right? And so you let the doctor hand this to them. So make sure parents are getting this card. It's very useful and it answers a lot of the questions, the basic questions parents have, okay? Last of all, as far as sedations, some of our, a portion, or maybe about 30 to 40% of our sedations have to be pre-authorized, okay? That means that we have to let the insurance company know in advance that we are doing the sedation and they have to authorize us to do it, okay? If a patient has a DentaQuest, then they need that authorization. Now, if you're scheduling a patient, you know, a week out, that's not a big deal because Joanna catches all those when she comes in. However, anytime you are scheduling a sedation with less than like a day or two's notice, that is something that has to be checked and has to be verified, okay? And so I talked to Joanna, and the best thing for her is she'd write that patient's name on a slip of paper and make sure she gets it or give it to her, and she can make sure the authorization takes place, okay? So Joanna's where all that gets fallen to, at least at the moment, okay? Make sense? All right, very good. All right, there's sort of some sedation success tips for everybody, and there we go. Awesome, awesome. All set.